Hi, I am Dr Yeshwant Mane, Director, Atharva Infertility Centre, Nasik. I am a practicing IVF specialist since last 15 years. Today we will be discussing upon when to go in for a second cycle in case your first cycle is negative. The most important criteria or deciding factor to undergo a second cycle for IVF is the age of the patient, her ovarian reserve, and number of embryos formed in the first cycle. If the age is on the higher side, if the number of eggs or embryos are formed is less in number, and if the quality of the embryo is not good, it is advisable that such patients should go for a second IVF cycle immediately. It has been a principal practice at Atharva Infertility Centre, Nasik since last 15 years that we follow freeze-all technique. Freeze-all technique is that in the first cycle where you stimulate the female, you do ovum pickup, we do ICSI, culture the embryos, grow them up to day 3, and on day 3 we freeze all the embryos. So there are two sets of patients who have adequate reserve and who have a poor reserve. So if the patient has a poor reserve and if the number of embryos formed are less, we advise the patient not to waste time and again go in for a stimulation and do ovum pickup. But if the patient has an adequate reserve, like if the patient has a tubal factor for infertility or unexplained factor for infertility or male factor for infertility, in the index cycle, if you harvest and culture some 8 to 10 good quality embryos, these embryos, they are stored in a special instrument. It is called as cryotop, and that is frozen at minus 196 degrees in liquid nitrogen. Suppose the patient has 8 top quality embryos on day 5. So we freeze them 2 embryos on each cryotop in 4 different lots. Suppose if unfortunately the patient is negative in the first attempt, then the patient need not hurry if the patient is not financially and psychologically ready for the second cycle. Because the embryos which are frozen, they are very safe, they are well preserved, and they can be used anytime in the next 10 years. If the patient has got good quality embryos, if the patient wishes, they can go in for a embryo transfer after 2 menstrual periods, or they can go for an embryo transfer whenever they are mentally and financially ready. So it all depends upon the indication for IVF and age of the patient. If the age is on the higher side, definitely you need to fasten the treatment, and if you have good reserve and if you have good number of embryos frozen, you can schedule your embryo transfer accordingly. If you have any queries or any suggestions, please write in the comment box below and we'll be happy to answer your queries. Thank you.